Health unions are worried the surge in COVID-19 cases in the country may be just the beginning. All provinces are seeing a rise in positive cases and the rate of infections is worrying. Simon Hlungwani, who's the president of the Democratic Nursing Organization of South Africa, says the high number of infections and the new variant could cause the health system to be even more overwhelmed. He joins us now to talk further about this. Thank you so much for your time, Mr. Hlungwani. Let's perhaps start with the current state of affairs that the country's healthcare workers are working in since we entered the second wave of the COVID-19.
Well, thank you very much for having us. I must say that we are extremely worried because currently the system is overwhelmed. There's a high number of bed occupancy. The occupancy rate is getting too high, particularly in the four provinces, Gauteng, KZN, Western Cape and Eastern Cape. It makes us very worried because then it means the system will get a strain which may lead us to a crisis point because there will be not enough staffing that will be able to take care of the patients themselves. But also we're going to run out of available beds should more demands be even higher in terms of the infection rate and most people requiring to be admitted in hospitals. That makes us more worried in that it might get us to a crisis point, which is what we do not want, particularly because we know our behavior of our citizens during this festive time. Is that people become careless, and we are more worried about the behavioral change that people are not heeding to the call for the society to do so.
Right, and I'm glad you bring up some of those issues that you've just raised, but I'm wondering what kind of intervention would you like to see happen before we get to this crisis point that we're talking about?
Well, it's for us as society to take control and take charge of ensuring that we protect ourselves by ensuring that at least none of us get infected. Because as soon as you have one person getting infected, it means that person unwittingly is going to infect other people. And as a result, it's going to replicate and have a high number. So what we would want to see is society taking charge of controlling the spread of the virus. That's what we would want to see. But also we would want to see the preparedness of the health system in general to making sure that we have available staffing, but we know that we are challenged in our country. We don't have adequate nurses and doctors who are just unemployed or who are seeking employment at the moment that we can get a high number that we have. So currently we have a strained health system because nurses have died during the COVID-19 in high numbers. We have got a shortage of nurses because we have not been training enough. And currently there are those who have been employed on a contract basis that we are saying we're calling the department to employ them on permanent basis because it shows that we're going to need them even for the future. But as it were, if people can behave quite well and make sure that we don't have other cases or that require admission, such as the trauma cases, be it from the stabbed wounds or gunshots, or it can be accidents related. If we have less number of those who will then have available beds to admit for COVID-19, should people need beds to be admitted. But if as society in general, we can control the infection, that situation cannot arise to ourselves. But we are worried that our behavior is showing and pointing that we are not really taking and heeding to the call to make sure that we prevent the spread at the current moment.
So would DENOSA in this particular situation support a harder lockdown just to ease the strain on the health facilities?
Yes, we think in order to control our behavior, because we know that society needs to do behavioral changes. And currently, we had expected that the president would implement a stricter lockdown for us, even if it's not a shutdown of economy, but at least some regulations can be brought back, like such as the curfew, to make sure that at least the curfew is more stricter, increase more hours of a curfew, the sale of alcohol to be more stricter, and then because we know that alcohol and movements are the ones that are currently maybe spreading the virus, because once people get to know that they can move more and they even move in the evenings when they are drunk, And when people are drunk, they then behave in a more careless way. That's what we're hoping, that at least if the situation still remains, we think the president or the country must be have more stricter lockdown rules, and that's what will enforce behavioral change to ourselves. It was not planned or not wished for, but that is the only way you can control behavioral change, just as we did during the first lockdown, and the first wave was able to be controlled, and particularly because it was a hard lockdown. We don't wish for a hard lockdown because that will be dire to the economy. However, it is what can assist us in the health sector to be able to cope with the burden that we have at the current moment.
Simon Hlungwani, unfortunately, we have to leave it there. That is Denosa's president giving us insights of the union's fears around a crisis at our health facility as we are in a second wave of COVID-19. On to